lady thing, but
and be careful how you touch her.
and you got to be careful how you touch her, because evidently you can offend the board, and that happened to us on one Tuesday night where we didn't get to have a show at all because they ran random commercials throughout the entire show. So do touch her nicely, and when you call in to win a prize, it's that phone right there. It's the mystery phone. That is our bat phone. Can you get a picture of our bat phone? All right, so come on, let's go. Let's take a tour. Oh, by the way, here is the fish bowl that we get to be in. You can see the reflection on the window?
1 minute,
Oh, how depressing. We have 1 minute. Let's go over and let's invade Mark Davis and see what he's doing and see if we can make him mad. Oh. Doesn't look like anybody's even in there. They must have done a pre-recorded show. Come on, let's walk this way. You know, again, yeah. Okay. See, this. Hey, good morning. How are you?
I'm well, yourself.
I'm gonna turn the light on. Is that okay?
That's all right.
See, this, for some reason, is the green room. Now, I don't know why they really call it a green room. It's more like an avocado room because it looks like kind of an avocado. And it's got a lot of pictures on it. I would think an avocado wouldn't have a lot of pictures on it, but it does. And this is where you come and you sit. And they provide you with refreshments here at KEXB. All the water you can drink. Would you like a bottle of water?
Sure.
All right, over here. We have a taker.
Thank you.
You're welcome. Malaysia, would you like a bottle of water? No, but I think JP would. I'll take one just in case somebody else. So we've got to go get back inside the studio because the music about to start and Dr. B is still asleep. So we want to make sure that we don't leave him stranded.
It's back with On Point
bring
with
us back.
JP and Dr. B. And we welcome you on this bright sunny morning. At least it's sunny somewhere up above the clouds. We're glad to have you here. We have in studio with us Dr. Norm Clothier, and of course Mustang Callie is here this morning. We're glad to have her back as well. We're talking men's health this morning and been talking about cholesterol. And our producer, Action Jackson, Dr. Clothier, said he had a question for you.
Yeah, let's hear it. What's on your mind? Sure. Yeah. Yeah, that's a good question. Absolutely. Yeah, there actually are artificial hearts and heart boosters that people get into terrible heart disease risk. I think it's all a matter of stewardship in a lot of ways. We know we got to take care of things, and it's interesting that the heart is often also what we refer to when we're essentially talking about people's soul. You know, when we consider the true core essence of someone, it's often referred to as their heart, or they have a heart for something. It's interesting that there's that much importance placed on, you're right, a very small physical organ that means so much to our heart, to our body, brain, and soul. And I think we just got to take care of what we're given. And, that's a very good question. It's interesting, if you hurt a kidney, it's almost impossible to choose to only hurt one kidney from the health standpoint. We have two kidneys, but you can't selectively say, well, I'm going to protect my right kidney and I'll just, not take care of my left kidney at all because I've got two. So, I don't know whether paired organs or not makes a difference there. But I do know that God put the heart at the core of the body under the rib cage, got lungs protecting it, got a sac around it called the pericardial sac to protect it, got a lot of tissue there to keep it alive and going at risk to the rest of the body. And I think it's interesting that it's right there at the midpoint of basically the body being so important there.
Dr. Clothier, let's jump right in here back to cholesterol.
Mm-hmm.
My first big question is, it seems like some of the science has revealed that you're at a much higher risk as a genetic issue versus an eating issue. And that if you do have the genetic or you're prone to higher cholesterol as a result of your genetics, then it is what you eat that may matter because it doesn't help your genetics. But folks that are maybe not genetically prone may not have to worry so much about the bad cholesterol. Of course, always worrying about the good cholesterol. And I'll reveal mine. I'm going to violate HIPAA right now and offend you. But I think my cholesterol, good cholesterol, when I was not exercising, was like at 33, 31, 29, which you told me, John, you got to do some kind of exercise and get that good cholesterol up.
Sure.
So is there any truth to the matter that genetically prone folks are at a much higher risk, and folks that are not genetically prone, really the eating doesn't make too much of a difference?
Boy, good question. I think it's all part of the package. I think you've got to take care of things across the board with moderation. It's kind of like, if you want to look at just the egg, for instance. The egg got beat up in society for containing cholesterol. There were people who would not eat eggs. I remember my poor little grandmother, years back when cholesterol first came out as a test, was told she had high cholesterol and she had to avoid eggs. So every day when we'd visit her, she'd talk about, I can't eat eggs because, that cholesterol's up. And, of course, over time, we found that that's not a factor, and that eggs actually don't contain as much cholesterol as was first thought to be true anyway. But it's really moderation. And really, my grandmother practiced that because she wouldn't eat eggs when it was time to talk about not eating them. And then a little while later, we'd eat something with eggs and, all kinds of things, whatever she felt like. So the key is moderation. And I think getting body weight down, getting exercise as an active part of life, and I have a couple of interesting stats on that I'll share here in a second. But the real key, looking at the ratios and the total value, but also family history. If you were driving down a road and a sign said 1 in 5 people are going to die in 100, let's say a mile, how many of us would want to drive down that road and see if we're one of the 80%? It's I think you'd want to get off that road, or you'd want to change that road. The way I view cholesterol and cholesterol treatment is that that's one of the ways you can change at least somewhat on that pathway. So in other words, that sign may say 1 in 5 people are going to die in a mile, but maybe with cholesterol treatment you could reduce that, maybe to 5% instead of 20%. It's still not great. And I do think, as you alluded to before the commercial there, talking about masking levels, there are factors about cholesterol and heart disease we don't understand. There are people that have heart attacks with normal cholesterol levels. So there are other factors that we're still trying to figure out.
In talking about medication, let's go ahead and jump to that, because I've heard here recently that medication just seems to really give a false reading on what your cholesterol really may be, that it really isn't preventing high cholesterol. Now, is there any truth to that?
Well, that is a point of great controversy, and I can't really get into the entire controversy, I think, here. There are a lot of issues. I can tell you that there are studies that clearly show less heart disease and less vascular disease in people with lower cholesterol levels with medicine. And the one thought is it may not be about reducing the number so much as it is so-called plaque stabilization. You were mentioning, John, about the yellow spots you see in pictures and such. Those form together to form plaque in an artery that blocks it gradually, and sometimes a little piece of that seems to break loose and go plug another spot and be trouble. And cholesterol medicine appears to reduce that risk of a clot breaking loose. So it may not, you may not always have, there will never probably be 100% issue in medicine that just clears everything up. None of us are just suddenly going to live forever if we get a normal cholesterol level. But it's all about risk reduction and prolonging life and quality of life that we feel is quite valuable.
Dr. Clothier, I've always wondered this. My diet's been poor, there's no doubt, from about the age I was about 25 until now when I started eating right again.
Sure.
And of course, I've stayed away from diet food and just eating regular, good, healthy food and putting good combinations together. Right. But how do you answer the question of, you got a 98-year-old who's still smoking, drinks a scotch a day, drinks 3 cups of coffee, and is still going, no heart disease.
That's their secret to life.
Yeah, maybe it's the coffee, it's the antioxidants, because I'm a coffee drinker. But I think it's kind of like trying to figure out why one child who's 11 versus his classmates ends up getting a leukemia. There's just some factors we don't understand. And some of those, there are always going to be people with premature death that you hear about, and people with a prolonged life that you hear about. And that's why there's no 100% in medicine. You know, we just don't see a pattern that is always the same pathway.
Yeah, we just don't understand what causes the outliers that are different, the
Exactly.
anomalies that take place in our life and lives of others.
Absolutely.
No excuse. Stress also can play a part in cholesterol too. They say.
Yes, it's interesting that there are two factors that really are hard to put a finger on with all kinds of health risk disease, and one of those is stress. The other is inflammation, and inflammation can come from stress, maybe also from infection, maybe from a lack of exercise, for instance. I actually just saw a study yesterday. In fact, I happened to be at a medical conference the last couple of days that was talking about increasing body temperature for a few minutes a day in a sauna or hot tub actually has been associated with lower vascular risk, which is interesting. First, I'm not sure exactly how they measured all that and figured it out, but if you think about that, if you get in the hot tub or sauna, you might reduce stress and you might reduce inflammation in other areas by basically increasing your blood flow to areas of the body that may not be increased to otherwise. That's not to say that should replace all other exercise, better eating, whatever. You know, it's all part of the package of putting things together. But I've often found one of the benefits of exercise is stress reduction. You know, I think when I see somebody just stressed out like crazy, I always think about them being at risk of heart disease because I think that's true and it raises blood pressure and such. But exercise tends to reduce that stress response too.
So one of the reasons for increasing the emphasis on exercise is to reduce the stress, which is going to help with cholesterol, heart disease, everything else.
Absolutely, right.
And certainly with the mental condition, for sure.
Mm-hmm.
Well, Dr. Clothier, what kind of research is out there, or what do you have that may help folks reduce cholesterol, reduce heart risk, things like that? Some basic stuff.
I think one of the essentials is absolutely just healthy lifestyle. It's interesting to me how many people I'll see who tell me they're healthy and that they don't have any concerns, and then they'll suddenly have, chest pain or an actual heart attack or need a stent placed. And prior to that, they don't want blood pressure medicine, they don't want cholesterol medicine, they don't exercise, they don't lose weight. Then they have that scare, and all of a sudden they take their medicine, they lose weight, they exercise, and they feel great. And we always wonder, why didn't you do this before the catastrophic event? And that's human nature. And it's hard to overcome that. Self-control is a great thing, and taking care of the body in general is, a big step in that.
All right. Well, Dr. Clothier, if you'll stay on with us for just a few more minutes after the break, then we're going to get into what am I doing with my fitness to be able to get my heart in a healthier place, and talk a little bit about that with Brian Beck, our certified personal trainer and nutritionist. So stay tuned as we continue with Dr. Norm Clothier in Men's Health.
Did we have a question come in for Dr. Clothier?
Oh, yeah. I
We
almost
need to
forgot
answer the
about that.
process. So let's go ahead and jump to that, and we can answer the
Okay.
prostate question.
Let me-
And the question is, if if we don't, because I think it goes off of you were saying, hey, the screening thing may not be real necessary, men don't die from prostate cancer
But
necessarily.
with it, generally,
Right.
I would be happy to.
But so his question was, can the cancer from prostate spread throughout the body though, and cause you problems?
Yeah.
So if we can address that, and then, are you a nutritionist?
I'm a lay nutritionist.
Okay.
Yeah, I talk a lot about it, but I don't know the details as
Do
well
you
as I should.
have a nutritionist in your practice?
No.
Do you mind if we bring one in to talk about healthy foods and things like that for Thanksgiving holiday?
Oh
Christmas
no,
holiday?
that'd be wonderful.
Okay.
Yeah, I think it'd be great.
Okay.
And we refer out for all that, but
Okay. Is there a nutritionist that you particularly like that you would like to invite as your guest on the show?
I could check with one to see if she would do it or
Okay.
could do it.
Yeah.
What day would that be?
Brian. She has Brian on the line.
Oh, okay. Thank you, Shradius.
Probably on Monday, was what we talked about, having it with the health.
Yeah.
Next
emphasis.
Monday.
Yeah.
Okay.
You
I'll
well,
see what
we
I
want to
find
do it
out.
next Monday, talk men's nutrition, and let Dr. Clothier kind of run that
Sure.
30-minute episode a little bit.
Yeah, we need to do the heart disease though, and I don't know how long you have today.
Only a few more minutes. I gotta get.
Well,
to
we
work,
need
so.
to get Brian on the phone anyways. We can
Yeah.
talk heart disease next Monday.
Yeah.
Yeah,
We
and
need to cover
nutrition.
that.
Would
That'd
that
be
be
a
a
fair
fit?
combo. Yeah.
Okay.
Yeah.
So I have a question. Is a heart murmur,
Alright.
is it truly a heart murmur?
Is it?
It's
That's
just
okay.
like
We'll just keep
extra
rolling for
sound
now.
of the heart
Yes.
and
It's about to
like-
die, 'em.
4 out of 5.
But we're gonna run you right into the ground.
Yeah, 1 in 5,
and then we'll
which
pop
usually
back
is
up with
there
something else
like
and load
a
up with my
birth.
phone if we have to.
1
So
in 5 have
let's go
meaning
show you
like
where
a hole in the
Mark
heart.
Davis